Welcome back to Clinic Annex. Today we will be discussing glaucoma, and that is because 9th to 15th of March 2025 is World Glaucoma Awareness Week. So we are creating awareness about glaucoma this week, and you will have seen hospitals, the government, NGOs talk about glaucoma at different times this week, and that is why we're also talking about glaucoma. Glaucoma is a leading cause of blindness worldwide, and it usually causes blindness in a tricky way, and that is why it often succeeds with people that have glaucoma. The reason is that, first of all, there are no early symptoms, and secondly, it starts with peripheral vision. It begins to take the peripheral vision or side vision of a person, and so because they are seeing the front, they feel that they are seeing, but it is reducing their field of vision gradually until they can no longer see anything. Unfortunately, the blindness caused by glaucoma is irreversible. So what is glaucoma? It is the damage to the nerve that connects the eyes to the brain, and a lot of things can get it damaged, especially high intraocular pressure, high pressure within the eyes. So who is at risk? First, those that have a family history of glaucoma in a first-degree relative, their father or their mother or one of their siblings has glaucoma, they are at risk. Then another one is African descent or Asian descent. So if you are African or you are Asian, you should also get screened from age 40. Age is another factor. Generally, it should be age 60 and above, but for those of Asian and African descent, it should be at age 40. Other risk factors include medical conditions like hypertension and diabetes. They can also be responsible. Or raised intraocular pressure, high pressure within the eyes. And this can only be known if you go for a check. Another risk factor is prolonged use of steroid eye drops. So if you have been on a steroid eye drop for a long time, please, you are at risk and you should get that eye checked. And that is why if you have been on an eye drop, let a doctor or a pharmacist help you to check whether it is something you should continue to use and for what reason are you using it. These are some of the risk factors for glaucoma. So what should a person do who has any of these risk factors? They should go for targeted screening. That means that we cannot screen everybody in the population for glaucoma, but those that have the risk factors should go and get their eyes screened for glaucoma. And because it is irreversible damage that it does, it is very important. What are the symptoms? Well, it is so similar to high blood pressure because it has no symptoms in the beginning. No early warning signs, no symptoms, except the person has one in particular that is called angle closure glaucoma, in which the person can have severe eye ache, and then they have symptoms, systemic symptoms like vomiting and nausea. In that case, it is an emergency. They should see a doctor, otherwise the eyes can shut down in a short while and they won't see anything again. You know that high blood pressure doesn't have early warning symptoms, but yet it is damaging the body organs. The same with glaucoma. It doesn't have early warning signs, but it is damaging the eyesight. They both do not have cures, and they both can be treated. It cannot be prevented. So the solution is to get yourself submitted for examination, especially if you have any of these risk factors that we have mentioned. What is the treatment? The treatment is lifelong management with eye drops or oral medication, and sometimes your doctor might recommend surgery for you. Whatever modality of treatment is recommended for you, be sure to comply. If you do not comply, it is an irreversible damage, like we said. So that is the reason you should comply. If you comply, your sight will be intact. So please, let us share and spread this news to everyone so that together we can save sights. Please, let everyone see this video. And please do not forget that good health is great wealth. I'll see you again next week, God willing, with another topic. Until then, please be sure to have done an eye check or to have scheduled one at least. Thank you once again for watching, and bye for now.